Hello, once again, Autism Nation. Thanks for joining me on this week's episode of the Adult Autism: A Spectrum of Uniqueness podcast. And this week, I'm glad to welcome Dr. Kenneth Roberson. Dr. Roberson, thanks so much for being part of this podcast today.
You're most welcome. I'm glad to do this.
Well, listen,
Fun.
I thought since you have a specialization in adult autism, I wanted to bring you on to just kind of pick your brain a little bit about what you do, what your experiences have been. And one of the things I'm going to ask you about a little later is this concept of what's called the theory of mind, which I know that you've written about. Um, but let's just start off. Tell us a little bit about yourself. How did you get involved in doing therapy with autistic clients?
Yeah, well, I've been practicing since 1985, and back then, and I was a child psychologist for a while, and
Oh,
I saw some children who were different than sort of what I had been used to. Um, I realized after a while I really didn't understand these children. I really didn't understand what I was doing or what to do with them. And you can probably guess where this is going. These were kids on the autism spectrum.
sure.
Back then, there was not a lot known. At least there wasn't as much known about autism as there is today. So I really didn't know much about autism, and was sort of scratching my head trying to figure out what to do
Yeah.
and understand these kids. Um, so I started reading and educating myself. Fast forward many years, I shifted my practice into working with adults. Realized, of course, that children grow up to be adults, and
Mhm.
there are a lot of adults on the autism spectrum, and so I kind of transferred the knowledge and skills I've been developing as a
Sure.
child psychologist to working with adults. Wrote a book. I've written many articles, blogs, and now see adults individually and neurodiverse couples, and then
Hmm.
I do assessments to determine if someone meets the criteria for autism spectrum disorder, as it's now officially called.
Wonderful.
That's me.
Okay.
Yeah.
So I'm kind of curious, what is it that brings autistic adults into therapy? I mean, what are they looking for? What types of issues do they have that they want your assistance with? That kind of stuff.
Yeah, well, there are several areas. One, in no particular order, some people are having difficulty in their relationships. They might be married or partnered for a while, and their neurotypical partner is having a hard time
Hmm.
understanding them, and vice versa. In some cases, they're both on the spectrum, but oftentimes it's a neurodivergent couple relationship, and so they're people are looking for help for that.
Yeah.
Obviously, if some people come to see me individually, oftentimes it's has to do with work-related difficulties, struggling, getting along with coworkers, communicating difficulties. Um, and then if outside of work, relationship challenges, getting along with
Hmm.
people, um, um, those, I mean, those sort of,
Yeah.
those are the sort of general issues that people come to see me about. A lot of it is that I think the main kind of core problem is challenges interacting with other people and socially desirable and comfortable and
Hmm.
mutually um, satisfying way.
Yeah.
So
In some of these issues that you're mentioning are issues that neurotypical people would be coming
sure,
into therapy
absolutely,
for.
absolutely. Yeah,
And
absolutely.
and it just might be just a little different slant on, what's going on with a neurodivergent client and those
Right,
dynamics that occur in relationships with people and things of that nature.
right, right.
And
Exactly. You're exactly right.
and I heard you say that you also do assessments as
I
well.
do.
And
Right. So, well, so people, some people come to see me because they're not sure that they
yeah,
have autism. They've thought about it. They've felt like they've been, in many cases, different from others since they were young. But they they don't know why or what's going
yeah,
on, and they want to see if it might have to do with autism. So, I go through a process. I meet with them for 3 sessions. They fill out some questionnaires ahead of time. I communicate with someone who knows them well, can answer some questions I have, and make a determination whether they they meet the criteria for ASD, the criteria that's outlined in the DSM-5, which I think
sure.
imagine you're familiar with. So
Yeah. Yeah, and I know
yeah.
that it's a challenge because you and I were probably trained in more of a medical model
Mhm,
type of approach,
mhm,
but yet there's a neurodiversity affirmative type of approach that's really
mhm,
starting to come on the scene now.
mhm,
And when you think about, well, in terms of treatment recommendations, you want to help these folks, but yet there's this opposing viewpoint of yet are you trying to get a person to like make better eye contact or something like that to make them neurotypical,
mhm,
or maybe that's not what we should be doing.
mhm.
How do you respond to those types of things?
Yeah, well, it's a good question you're bringing up. It's
Yeah,
an important question. I don't think of myself as trying to turn people into something they aren't.
yeah.
I wouldn't do that with anyone, I think.
Mhm.
What I see my job is about is helping someone with the challenges they have, um, to develop the skills that they need to function more effectively in
Mhm.
the world,
Mhm.
whatever that might be.
Yeah.
Um, Developing better social skills, for example, communication skills, better understanding of themselves and some of the sort of uh, keep using the word challenges. I'll use it again. I guess challenges that they have just as a person,
Mhm.
the struggles they might have with uh, confidence, self-esteem,
Mhm.
and so on.
Yeah.
Um, so yeah, I don't, again, to repeat myself, I don't think of my aim being to turn people into sort of quote normal, a normal,
Mhm. Yeah.
whatever that is. And we know that there's no such thing really. Uh, um, so, so in that sense, I think I believe I have an affirmative
Yeah.
approach to working with people on the spectrum,
Yeah.
as I would, I think, with any other kind of
Yeah. That
difficulty.
that makes total sense.
Yeah.
Well, I think one of the, you have brought up the word challenge, and I think one of the challenges that you'll see is something that you've written about actually called theory of mind.
Mhm.
And I've heard about this concept. I've actually heard about it more with kids in the field of developmental psychology. Haven't heard about it quite as much until recently with autistic adults. Wonder if you could say just a little bit about this and maybe how
Mhm.
you incorporate this into your work with autistic clients.
Yeah, well, the concept has to do with the ability of someone to imagine what another person is thinking and feeling
Okay.
based on the way their actions, the way they appear, things they say, how they say them, and so forth. Um, and first of all, it begins with the idea that um, people can think differently than we do and
Hmm.
feel differently.
Hmm.
Um, and as an aside, or in addition, I guess there's a part of this that's has to do with the concept of false beliefs, meaning that we for use myself as an example, can imagine that you believe things that aren't really true, but you believe them to be true.
Right.
So that you have a perspective that's very different from mine,
Hmm.
but it's a legitimate, I mean, in most cases, it's a legitimate point of view. May disagree with it and so forth. In any case, this the idea that people, back to what I was saying earlier, people can think and feel differently than I do.
Sure.
Um, so maybe as a quick little, we talked about child development. Are you familiar with the story of the test, the Sally Ann test?
I have heard of that, but
You've
maybe
heard of it?
the audience, if
Yeah,
they're not familiar
for
with
your
it.
listeners, I'll describe what this is. So imagine there's a young child in a room with a adult. The adult has two dolls.
Okay.
One's named Sally and one's named Anne.
Okay.
There's a little basket in front of the two puppets. Um, and the adult, I guess that's the interviewer, maybe I'll use that word, shows the child who's watching
Mhm.
this basket, and there's a ball in the basket. So the examiner takes the ball out and gives it to Anne, the little puppet. And Anne puts the ball in back into the basket.
Okay.
And then Anne leaves. Little puppet Anne leaves.
Okay.
The interviewer explains to the child that Anne is gone and can't see anything that's happening at this point.
Okay.
Sally takes the ball out of the basket and puts it in a different little basket.
Okay.
Are you with me?
And the child is still watching
Still
this.
watching this.
Okay.
Now let's imagine this child's about 3 years old.
Yeah.
Anne comes back, little puppet Anne comes back into the story. And the interviewer asks the child where Anne thinks the ball is. And the 3-year-old believes that Anne thinks the ball is in the basket that Sally put the ball into.
Hmm.
Okay? Because the child saw the ball in that, Sally put the ball in that basket,
Hmm.
even though Anne didn't see it. Just to try to kind of encapsulate what I'm saying, the child is thinking, doesn't really understand that Anne is thinking differently than the child.
Right.
Are you following
Yes.
me?
Hmm.
A 4-year-old will say that uh, Anne is looking in the where Anne thought the ball was going to be, thought the ball was, saw the ball before Anne
Right.
left.
Right.
Are you with me?
Yes.
Okay, because the 4-year-old realizes Anne's thinking differently than the child is.
Right.
Anne doesn't realize that the ball has been changed or transferred, to a new thing. Anyway, the point of all this is this is sort of so-called test of the theory of mind, meaning that 4-year-old now has a conception that Anne has a different perspective than the child does.
Hmm.
Um, fast forward again to an adult. Um, some of the difficulties that adults on the autism spectrum I say some, not all, um, have to do with this ability to imagine other people thinking and feeling differently than they do. Um,
And I don't mean to interrupt, but is it similar to the concept of trying to put yourself into the shoes of another person, that phrase?
it's it's exactly the same.
Okay.
It's exactly the
Mhm.
same. Um, so my work often involves helping people develop that skill.
Mm,
And I think of it as a skill.
okay.
Like most skills, it can be learned.
Okay.
Um, and when that happens, as you can imagine, people's interpersonal um, connections, their ability to interact with other people
Sure.
improves.
Hmm.
Getting along with people is easier. Um, and there you have it.
And I think you just answered my next question, because I was going to ask you why is this so important for them to learn? Um,
Mhm.
and I guess maybe another part to that question is why would it be important for a neurotypical partner or friend to be aware of theory of mind? I mean, that's another question that goes along with that.
Well, I think it can help someone just appreciate the challenges that their partner or friend who's on the autism spectrum may be having in
Yeah,
understanding them and relating to them successfully.
sure. Yeah, I get that. Yeah.
So to me, it's a hugely important concept in helping people on the spectrum. It really makes a difference. Let me give you maybe an example of something that I could sometimes do recommend to help develop the skill that might sort of
Okay. Sure.
also kind of give you a better idea of what I'm trying to get at. And that is to uh, observe some people. Oh, let's say you go to the mall and you just sort of sit there and you watch people and imagine what they what might be going on with them based on how they're acting.
Mm-hmm.
It doesn't have to be true.
Yeah.
It just may be the concept of imagining.
Mm-hmm.
So let's say a couple in the mall are laughing together and uh, seemingly having a moment of pleasure.
Yeah.
Um, I would encourage someone to watching that scene to just try to think about what might be going on that causing that. It
Mm-hmm.
doesn't have to be true, but what
Mm-hmm.
might be going on to cause that?
Mm-hmm.
The purpose, of course, is to help someone think about what's going on with someone else
Mm-hmm.
without having direct knowledge of that.
Mm-hmm. Yeah. It's almost like it's a muscle you're trying to get them to strengthen in a sense.
Exactly.
Yeah.
That's exactly right.
Yeah.
That's a good analogy for
Yeah.
sure.
And I could see how this could pose problems in relationships, because the neurotypical partner or friend or whomever it is thinking, don't you know how I'm feeling?
Mhm,
There's an assumption there that you should know how I'm feeling, or
mhm,
you should get kind of how I was thinking about this, but it's not that easy
mhm.
for an autistic person. And so
Right.
these types of things that you're recommending sound like it's well, you kind of had put it, conceptualize it as a skill for them
Yeah,
to learn. So it's something for them to learn, to help in their relationships.
absolutely.
Yeah,
Absolutely.
yeah.
Yeah, right. Absolutely. Yeah, 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 yeah. Um, yeah, it's an important skill. It translates into many different types of situations. Um,
And how long does it take a person to strengthen that muscle? I mean, I can imagine that could be a tall order for some clients.
yeah, well, it's hard for me to give you
Yeah,
a really clear timeline for that. It
sure.
depends a
I know
lot
that
on people,
varies. Yeah.
but um, what I will say this, I don't think this is a big surprise, but the most important are an important part of change, the change process is motivation.
Mm,
How motivated are you to want to change,
sure.
grow,
Yeah.
to um those people, of course, those of us who really want to succeed in the areas that we've been discussing about now are going to be able to do it. I, speaking very generally, of course. And it's not going to be that intensive a process.
Hmm.
We're not talking years. Um, those people who, on the other hand, aren't quite as motivated, dedicated to changing, of course, are going to find it much harder.
Hmm.
So for me, what I want to encourage people is to think about how much do they want this to happen?
Sure.
And if they have doubts, can they overcome those doubts about making it happen? They have some resistance to that. What could that be? And can they get a clear understanding of that resistance and then find ways of moving past that so that they want to um, uh, grow in this area.
Hmm.
So,
Yeah,
um,
I could see how, you could spend just a lot of time addressing that issue right there, the motivation, the
yeah,
potential resistance, to doing something different.
exactly,
This is change. I'm not a big fan of change. Perhaps the client
exactly.
might be thinking, and I don't want to have to do something different. That's sort of out of my comfort zone. And so I could see how you might even spend a lot of time just on those initial, we talk about stages of change, which you might be familiar with, but just
Sure.
spending time at those lower levels is to kind of prepare them,
Yeah,
for potential change if they decide to do that.
exactly. No,
Yeah.
I think you got it exactly right.
Yeah.
For
Yeah.
sure. For sure.
I'm kind of curious. I always, I'm wondering about key takeaway recommendations when I have my guest on. Do you have any takeaways or recommendations for autistic folks? They might be listening to this, whether it's pertaining to theory of mind or anything else that we've talked about today. Any recommendations that you have?
What comes to mind is, I think we've touched on this already, and that is to have an affirmative view
Hmm.
themselves as much as possible.
Hmm.
Now, that doesn't mean that we should reward bad behavior.
Yeah.
I would say that about anybody. So I don't mean to imply that everyone on the spectrum is doing what they should be doing.
Yeah. Yeah.
But I do want to encourage people to think of being uh, having differences as okay. It's
Yeah.
fine.
Mhm.
Um, what would this world be like if there weren't
Oh,
differences?
exactly. Yeah.
And who's to say really what is different? And it's sort of that's that's something that's a whole other subject. Um, so that's important to me.
Yeah.
I want people to feel good about themselves, to feel like they can be successful, that they can do what have the kind of life that they want to lead, um, and that it's really possible to do that.
Hmm.
I think one of the sort of I don't want to say damaging things, but it's the word that comes to mind. It's maybe not the right word, but let me explain what I mean. Is the idea that uh, autism is a neurodevelopmental disorder that essentially you're born with and you're stuck with. Um, Many people ask me, well, if I'm autistic, uh, what am I going to do? I'm, how am I going to, how can I change?
Right.
It's part of my DNA. It's who
Yeah.
I'm stuck with this. I am. And I don't think that's a very positive way to look at things, or a realistic way for that matter. Back to what we've been saying, people change.
Yeah.
We can change.
Hmm.
In fact, we change all the time.
Yeah.
There's no such thing as being the same person you were yesterday as you were today. Um, so so that's an important concept again
I
for
really like
myself.
that you bring that up because sometimes when I do my evaluations, the reactions will be different. Normally, they feel validated that finally I've got this. I've suspected this, that I've been autistic.
Right.
Now I've got validation. That's what I usually hear. But every now and then, it's the opposite type of reaction. It's almost like it's a death sentence
Mhm.
that they know that they're autistic, and there's still plenty of stigma to go
Oh,
around.
sure.
And
Oh,
I think
sure.
we're as a society, we're sort of moving
Absolutely.
beyond that. But boy, it's still around.
It is very much still around. It's a good
Yeah,
point you're making, and and that's why I am so um, clear in my thinking that I that it doesn't people don't have to have that notion. You
yeah.
just don't have to
Hmm.
think of yourself as having this death sense, as you say, or stuck being autistic and you can't be successful, you can't be happy, you can't connect with people in the way you might want to, or you can't, you just can't have a meaningful, enjoyable, satisfying life. That's not true at all.
Hmm.
You can, that can happen if you make it that way.
Sure. Hmm.
But that, that's true of all of us.
That's very true.
So,
That's a good point.
um, so yeah, I really do believe in a, back to, I think you used the word affirming, or
Yeah.
point of view about autism. That's changed quite a bit too over the last, I don't know how many years,
Mhm.
decades. It, you read some of the early writings on autism, it, there's an implicit, if not explicit, um, characterization of autism as a disease.
Yeah. Lesser than.
Sure.
Yeah.
Yeah. Really sick people
Yeah.
who who just can't change.
Yeah,
Just
I'm
so
glad
that
we're moving beyond that
I
now.
am too, and it's really encouraging. As you say, society
Yeah.
is changing the way people are seen. People on the autism spectrum are seen.
Well,
That's really,
how can people learn more about you? And I know you have several blog series and a lot of articles that they might be interested in reading. How can they
you know,
read these?
the best thing is to come to my website. They're all stored on my website. It's
Yeah.
uh KennethRobersonPhD.com. Kind of a mouthful, but
Okay.
I think I have well over 200 articles, and anybody can go in and take a look around,
And
see
I'll
what's
put that
available.
link on the
Oh,
show
thank you.
so people
Yeah,
can easily find that. And
yeah.
I've read some of those very good articles, very practical and easy to read.
Thank you very much. Can I just quickly turn the tables and ask what you do, what work you do, what you're interested in is in this and sort of,
Well, I do two things.
yeah,
So my main job right now is I'm a professor in a counseling
sure,
program, and I'm
sure.
about to retire.
Okay.
I've had a part-time private practice ever since I've been here.
Mm-hmm.
Was in full-time before that, but um, I'm gonna return to full-time private
Mm-hmm.
practice. But a lot of what I've done over the years is I've done therapy and I've done psych evals, a lot of the ADHD, but in about the past 5 or 6 years, a lot more autism evaluations, and for
Mm-hmm.
adults, obviously, who've
Mm-hmm.
always kind of suspected that. And
Mm-hmm.
it's like, well, but there's nobody here to do that kind of an evaluation.
Mm-hmm.
So it was a real interest of mine. My son, late diagnosed autistic
Mm-hmm.
person, and so I've really kind of gotten interested in this area and learning more about it, and kind of
Okay.
serving as many people as I can in whatever capacity I can. Yeah,
Okay. And your podcast is focused on
on
autism
adults.
on
Yeah,
adults in
yeah,
adults? Yeah.
yeah,
Wow.
yeah.
That's a great thing. I'm
Yeah.
sure a lot of people are interested in listening to
I think so. Yeah. And it's
your
nice to have you
episode.
folks on here because just to get the word out about this
Hmm.
and what's possible, and to try to
Hmm.
clear up misconceptions and all of this
Yeah.
kind of stuff that you and I talked about today. So yeah.
Yeah, yeah, good. I appreciate you doing this sort of
Yeah.
thing.
Well, I
It's
appreciate you spending your
yeah,
time with
thank you.
us today and everything.
Thank you.
And
Thank you. Thank you.
good
Thank
luck
you.
with everything that you do moving forward yourself.
Thank you very much. Thank you for having me on as a guest. I enjoyed our conversation. Again, people can come to my website if they want more information, and I'll try to listen to your podcast too, and keep current on what you're doing as well.
Sounds good.
All
Thanks so
right.
much. I
You
appreciate
bet.
it.
Take care,
Right.
Chris.